big driver of re-hospitalizations and emergency room visits today among the elderly as well as those with chronic conditions is problems with medication, so medication adherence. Either a patient's not taking the right medications or they're having a reaction to a combination of medications. The clinician has no visibility to what's going on with their patient on a daily basis.
Medication reconciliation is something that can be very well supported with remote patient management kinds of models, and it's something that we always encourage our customers to think about. Patients, I believe, don't take their medications not because they're obstinate or because they simply don't want to. I think patients fall into a number of categories. They either can't remember, they don't understand what it is that they're not sure what to take or what they should be taking or not taking. They don't understand what it's for. Maybe even most importantly, they don't really believe it's going to make a difference.
With remote patient management, clinicians can now see what's going on in terms of medication adherence, what needs to be adjusted. We have lots of testimonials from clients that have shown that they were able to head off a deterioration in condition that would have landed someone back in the hospital simply by being able to have that window of visibility into what was going on with medication and to be able to adjust accordingly.
So we know there's lots of studies that show that patients that take their medications clinically do better than patients that don't take their medications. But medication management, medication adherence is an area where an informal caregiver can really make a big difference. Adopting some kind of platform that includes the informal caregiver is a great way to ensure that you have a very solid medication management as part of your remote patient management solution.